Okay, so Mark is assessing the patient's neck right now. That particular movement is called cervical retraction. And he's just taking the patient to his end range motion, asking about whether it's producing his pain or not. And he's bringing him into what we call extension now. And again, trying to get him to his end range. And always asking the patient what they're feeling.
So this is, now as we mentioned on the interview, Frank has already gone through find out exactly what's causing his pain and where it is. And then from this point, when he comes in for treatment, then this is...
So this is part of the treatment, but Mark is also constantly assessing what's going on. So that's where the McKenzie Method differs from traditional therapy, is there's always an assessment going on, and the treatment will then be tailored to what he's finding. Okay.
And again, could he do it by the feel, or...?
Both the feel and asking the patient what they're feeling.
Okay. And then he will do this for how long probably will this treatment work? Because he started off with, he put a little bit of, was heat or cold on him to start him off?
He put some heat on, which helps to loosen up the soft tissue.
Okay.
And again, it depends on the patient. Some people will respond very quickly, so 5-10 minutes, and they're good to go. Other people, they have a slightly different problem. It can take longer. But again, everything is tailored to the individual, so the patient will get what their condition needs.
And as Frank said, one of the advantages of what you guys do here at CPRS is that you explain to the patient what they're doing and making sure that, they're not causing more pain. But as Mark mentioned, too, and is that a lot of these exercises, they can continue at home?
Correct. Yes.
So what could possibly he do at home that would benefit him?
There are seated techniques that imitate the motions that Mark is bringing him through right now, but we can also teach the patient how to do this movement off the edge of their bed themselves, or with a family member assisting. So it really depends on what the patient needs.
And again, when it comes down to a lot of these things, as Frank mentioned, with him too, is posture and overdoing it, not realizing that you're getting a little bit older and you need to help. So you find that often too, right?
Yes, and it's all about balance. So in our lives, we're always doing things in front of us, sitting, bending, lifting, everything's in front of us. We very rarely extend, so that's where that one myth we talked about comes from, but very often, as in Frank's case, extension is needed, and we teach patients how to balance out those activities within their lifestyle.